All right, so I am going to be giving an IM injection and a sub-Q injection. For this purpose, we are only going to inject air into our fake arm here. But first I would identify the patient, ask them for their name and their date of birth, just so I make sure I have the right patient before I give the injection. I would wash my hands, which I've already done, and then I would apply non-sterile gloves. And then I would identify the injection site. And once I have done that, I would take this alcohol swab, and wherever point of my injection, I would start there and then work in a circular motion and work my way out. Make sure it's all clean. And then I would let that dry for a minute. And then I would take the medication, which I'm going to be doing the IM first. So I have the syringe here. You're going to remove the cap. You're going to take your index finger and your thumb, and you're going to place about 2 inches and then pinch the skin. And then you would go straight in at a 90-degree angle for your injection. 1, 2, 3. And then you would aspirate. And there's no blood. So then you would count slowly to 10 as you're injecting the medication. And then once it's done, pull straight out. You would take the cotton ball, just apply a little bit of pressure. You would take your needle, put it in a sharps container, and hold this for about 10 seconds. And you could check it. If you need to apply more cotton or anything, you can. And then you're going to take a piece of tape and just put it on there. And then you would document and also check or document it in the chart, but also watch the patient for about 15 minutes and make sure they have no reaction. And then I would discard my gloves. Correct. I'd also wash my hands. And now I'm going to do the sub-Q injection. So again, I would make sure I have the right patient, ask them to state their name, date of birth, make sure it matches the information on my order. I would wash my hands, which I already have done, and then I would apply gloves again. And then again, we're only going to be injecting air for this purpose. And once I have identified the site for the sub-Q injection, again, once you have identified it, you're just going to take the alcohol swab, start in the middle, and work your way out. Let that dry. And this one, it's hard to do with this fake arm properly, but you would squeeze, and then you're going to go in at a 45-degree angle. So you tell the patients 1, 2, 3, poke. And again, you would aspirate, make sure nothing. So you're going to inject slowly, counting to 10. And pull straight out. You can apply cotton ball. Again, you're going to dispose of this in a sharps container. And once again, you will just place a piece of tape. You're going to document, watch the patient for 15 minutes, and dispose of the gloves properly. And wash your hands.